What does it mean when clinical trials discuss power and types of error? At the end of this video, you'll be able to discuss error and power in clinical trials like a pro clinical trialist. First, let's talk about two kinds of error that are possible in a clinical trial. The convention is to call a trial that shows a difference between two groups positive and no difference between groups negative. But in reality, there may or may not be a difference between the two groups. So then there can only be four possibilities, in two of which trial results are concordant with reality. Those are a true positive and a true negative result. Error occurs when trial results are discordant with reality. A type 1 error, or false positive, occurs when in reality there's no difference between groups, but the study shows a difference between groups. A type 2 error, on the other hand, or false negative, occurs when in reality there is a difference between groups, but the study fails to show it. The way I like to remember that false negative means type 2 error is that a false negative is a double negative. So it's two negatives, so it goes with type 2 error. Let's talk a little bit more about what goes into type 1 and 2 error rates. And to do that, we're going to need two terms, which are alpha and beta. A p-value is the chance a difference as big or bigger is obtained, assuming the null hypothesis is true and there is in fact no difference between groups. Trialists decide how many type 1 errors or false positives they're willing to tolerate by setting alpha, which is just the threshold for a significant p-value. Alpha is almost always set at 0.05 by convention, which implies that trialists are willing to tolerate a 5% chance of a false positive or type 1 error. Alpha is an arbitrary cutoff that we use by convention and should be taken in the context of the rest of the trial, including its secondary outcomes, especially when that p-value is close to the cutoff of 0.05. A great example of this is STOP-AH, which is widely regarded as a positive trial favoring steroids for alcoholic hepatitis in an important subgroup of responders, even though the p-value didn't actually meet significance. It wasn't less than 0.05. Occasionally, a lower alpha will be chosen to control the false positive rate, and this is often done in situations where there's multiple testing, for instance, if a trial has an interim analysis, or if there are multiple secondary analyses being performed. It can also be helpful in evaluating therapies that have significant toxicity, where the cost or harm of a false positive would be much greater. A higher threshold can be chosen too if the trialists are willing to accept a higher false positive rate, and this can be seen in bioequivalence trials, pilot studies, exploratory analyses, or in selecting covariates for observational research. So that's enough about alpha. Now let's talk a little bit about beta, which is the false negative rate. Trialists tend to reframe this as power, where a higher power is better, and power is just 1 minus the false negative rate. So just as an example, a power of 80% means there's an 80% chance that a negative result of a trial will be a true negative. Beta is really important for trials to understand because they need to understand how many people to enroll in the study to get an acceptably low type 2 error rate. Factors that increase power are having a larger sample size, having a larger absolute difference between the two groups, having less heterogeneity in the data, and having higher absolute event rates. So looking at that from a little bit different angle, when do you need a bigger sample size? Well, if you're looking to have a higher power, let's say increasing your power from 80% to 90%, if you're looking for a smaller difference between groups, if there's a lot more variability in the data overall, heterogeneity, or if there are very low absolute event rates, you would need to have a larger sample size. Let's summarize. So a type 1 error is a false positive, and a type 2 error is a false negative. Alpha is the arbitrary cutoff we set for our p-values and is the probability of a false positive, and beta is the probability of a false negative or type 2 error. Power, which represents the likelihood of finding an association if it does exist, is 1 minus beta. Clinical trials achieve greater power with a larger sample size, greater separation between groups, and less heterogeneity.